Before I enter the patient's room, I will verify the physician's order, and I will also scan to the patient's chart for significant findings to see if the patient is anti-coagulant or any contact precautions. Then I gather my equipment. I wash my hands. I enter the room. I introduce myself to the patient. My name is Maria. I'm a respiratory care student. I'm here to take you out to do an ABG. Before I started the process of the ABG, I'll gather my equipment and my ABG kit. I have the white size needle. I have my alcohol pad, and I have the cover, and I have my biohazard bag and the patient label. In this label, I will record the patient's temperature, the room number, date, the test I'm doing, time. If the patient is on ventilation, I will record the FiO2 that the patient is getting, and the FiO2 and the ventilation. Even if the patient is in room air, I will still record the FiO2. And I have my 4x4 gauze. And this package doesn't have a band-aid. And I will get a towel to give support to the patient's arm. I put my gloves on, and before I started the test, I will palpate both hands to see which one that I have the strongest pulse. And I'll choose this hand because this is good. I can feel a nice arterial pulse in this hand. And I will perform the modified Howland test. I will palpate, feel the radial and the ulnar arteries, and I will tell the patient to squeeze. While I'm pressing on the arteries, I will tell the patient to squeeze their hands and open and close. And then I will release the ulnar, and I look for collateral recirculation within 10 seconds. And I could feel that. I continue to palpate. I still get a pulse right here. I clean my site. And I clean my site, and I clean my gloves. I get my needles ready. I set my needles to the desired amount of blood that I need. And my gloves. I will pop it. I'll tell Mr. John that he's gonna feel a little pinch, and I want him to stay still when he feel it and not to move. There you go, you're gonna feel a little pinch. Okay, I got nothing. I'm going to redirect. I palpate. Still don't get it. Okay. Okay. I will apply pressure for 3 to 5 minutes. And if the patient is an anticoagulant, I will apply pressure for 10 minutes. And if I had a bandage, I will put a pressure bandage here. And now I will dispose my my needle into the shot container. I will close, and I will vented any air that's out, that's in the needle. hand and I will mix the heparin in the needle. I will put the patient label in the needle, and I will place it on the blood in ice if it's not gonna be tested within 30 minutes, and if it's more than 30 minutes, I will discard the sample, and I will chart in the patient chart that I obtained the ABG, and I run the test, and I wash my hands, and I exit the womb.